The Connecticut Department of Children and Families says that at least 8 children under the age of 2 have died from accidental fentanyl overdoses since 2020. The department now changing the way its social workers handle cases in an effort to get children out of harm's way. News 12 Connecticut Sean McCabe has more on the new guidance.
The notion of children ingesting or coming in contact with something that is so lethal really caused us as a department to have to look at our practices to see if we needed to kick things up a notch.
New DCF guidance being implemented this week triggers a meeting of interdisciplinary experts within hours of a caseworker finding fentanyl in the home.
Legal department, our clinical department, our medical personnel within the department, and anybody else that can help them make that assessment more robust.
Commissioner Vanessa Durantes says DCF will emphasize support and education in interventions, removing children from their homes only if necessary.
It's really trying to build up those community resources to keep kids safe in community, but there are times where we do have to remove children, and we do so very cautiously.
The CEO of Liberation Programs worries fear of losing their kids could keep some moms out of treatment.
And if a woman feels like they're going to ask for help and they have small children, the last thing we want them to believe is that they're going to risk losing their child.
John Hamilton also chairs the advisory board for the State Department of Mental Health and Addiction Services.
We have to look at it more from a child-proofing, taking prudent measures instead of just honing in on this fentanyl issue.
State officials and advocates agree education about Narcan use and safe storage are the most effective tools.
Particularly adult use substances, even over-the-counter medication should be out of the reach of children.
And if they are out there using substances, we want them to reduce harm for themselves and reduce risks to their children and their families, and we'll give them whatever information necessary to have that happen.
Sean McCabe, News 12, Connecticut.
DCF officials say that overdoses happen through ingestion, not skin contact, and children under the age of 5 are most at risk.